Hi, this is Dr. Ashish Parulekar, and I'm a practicing gynecologist in Mumbai. I have a setup at Jogeshwari and at Vileparla, and I mainly practice patients with infertility, and I do a lot of endoscopic surgeries. And some of the infertile patients might come with anemia, or even non-fertile infertile patients can come up with anemia. So today we are going to discuss anemia in pregnancy. And I just like to thank BabyChakra for giving me this opportunity. What we need to understand is that uh, many a times the hemoglobin is normal in a patient, and sometimes the hemoglobin may be less in a patient. And in such a patient, when she gets pregnant, then the hemoglobin levels are likely to drop further. So, in short, anemia is a frequent complication of pregnancy, and you can have hemoglobin less, which can be relative or it can be absolute. Now, one must realize that there is a lot of expansion in the plasma volume in pregnancy, and therefore the concentration of the blood falls. Or, in other words, because the water part of the blood rises, and comparatively, the red blood cell mass doesn't rise as much as the water part of the blood rises. And so there is a hemodilution of the blood. Now, why is there hemodilution of the blood? Is that this helps actually because during the childbirth, there is a blood loss of about 500 ml and in a cesarean of about 1000 ml. And in such cases, the blood lost will be a diluted blood. So it's a nature's way as to preserve the hemoglobin. Also, what happens is because of this, indirectly the oxygen carrying capacity of the blood increases. So what we have seen is many times patient may have a mild anemia, sometimes they may have a moderate, and sometimes it's a severe anemia. So severe anemia, we say when it is less than 6 grams, and mild or moderate may be around 9 or 10. So we say that when about 10-gram hemoglobin is okay in the third trimester, that is the last 3 months of pregnancy. Below 11 grams, we say is okay in the first 6 months of, not okay in the first 6 months of pregnancy. So what happens is if the hemoglobin level is around 11, then we can even observe the patient, ask her to have a good diet and monitor. And if her hemoglobin remains above 10.5 to 11, then we are happy. But once it starts falling below 10 or below 9, 8, then that's sometimes where the complications can occur. And what are the complications? So sometimes we have seen that those patients with severe anemia, that is hemoglobin of less than 6, might land up with preterm labor. That is, they deliver sometimes in the 7th month, 8th month. They can have spontaneous abortions. They can have babies with low birth weight, that is less than 2 kilos or 1.5 kilos. Sometimes we have seen that those patients with severe anemia can have an intrauterine fetal death. That is, the baby dies in utero suddenly. Many times we have seen that those patients who deliver, after the delivery, these anemic patients may end up with something called as a postpartum depression. Sometimes we have seen that the babies born of these mothers with anemia might have developmental delays. So the immunity of these children is less. They may tend to catch infections. And as these kids grow up later in adult life, they may not be able to withstand so many infections, etc. So what is important is that every woman who gets pregnant or who plans to get pregnant should have a hemoglobin checkup. She should make sure she eats good amount of food, nutritional supplements, and in case necessary, also take the iron and vitamins, etc., so that the hemoglobin doesn't fall. So how does basically the RBCs or the red blood cells, what they do is they help to carry the oxygen. So once the hemoglobin falls, then there are less RBCs and the oxygen carrying capacity of the blood reduces. And that is where all these complications start setting. So basically you have two types of anemia. One is iron deficiency anemia and one is a folic acid or a folate deficiency anemia. And lastly, you may have a vitamin B12 related anemia. Most common is around 80% or 75% of patients who are anemic in pregnancy. We have found they have an iron deficiency anemia. And this can be reduced by increasing iron rich foods. So what are the iron-rich foods? You can have green leaf vegetables, pomegranates, khajur, jaggery, fish, meat, liver, kidney. These things will help to increase the blood or increase the iron stores of the patient, and then chance of this anemia is less. The second is about 25% of patients will have something called as anemia related to a folic acid deficiency or a folate deficiency. So folic acid also is rich in some foods like green leafy vegetables, lemons, and even melons. So if women consume these kind of fruits and these kind of vegetables, then the chance of folic acid deficiency is going to be less. Also, we have seen that if a woman starts a folic acid supplementation before she plans a pregnancy and continues it later also, then the chance of having children with spinal deformities or spina bifida is almost eliminated. Another important thing to remember is folic acid levels tend to fall in the last 3 months. So even though many a times we doctors tend to give folic acid in the first 2 or 3 months, it is better if you continue folic acid later also. And especially those of the population which is a vegetarian population, we have seen that many of them have got what is called as a folic acid deficiency, resulting in a anemia. So some of the risk factors for anemia, or which kind of patients would land up with anemia, or those who have a higher chance of getting anemia, are those patients who have a hemoglobin level which is less even when they are not pregnant. So they will tend to get more anemia, or chances of anemia is more in those women whose hemoglobin is already low. Another group of patients is those who are having a multiple pregnancy, say 2 children, or means twins, or sometimes triplets. And we've seen that chances of twins is on the rise nowadays because of usage of artificial reproductive technologies like IVF and IUI. And also, when a woman has gotten pregnant once, delivered, and she's again pregnant quickly, say she gets pregnant in the next 6 months or a year, the gap between two pregnancies is less. These women will tend to have a lower hemoglobin or higher chances of anemia. Also, those pregnant teens we have seen may have a chance of anemia more often. Also, those women who have got a poor diet, etc. Also, those women sometimes who tend to vomit more, they would also tend to have anemia. So what are the symptoms? So these patients will present with tachycardia, that's the pulse rate will rise. They'll have tachypnea, or the respiratory rate will rise. They'll be tired. They'll complain of fatigue. They'll have some breathlessness, and they'll complain of body ache and backache, etc., irritability, and pale. They'll have pale skin. They'll have pale lips, and that's how we can diagnose anemia. So the main challenge is to diagnose anemia. What happens is, because of parameters which change in pregnancy, diagnosis of anemia becomes very difficult, but with appropriate blood tests, one can diagnose it. So what is the treatment for anemia in pregnancy? So those women who have got a hemoglobin of 10.5 or 11 may be left alone, but when the hemoglobin level starts dropping, they need to be supplemented with iron salts. So we can give them iron ferrous salts, or sometimes we can give them sustained release preparations of maybe 60 to 100 milligram iron supplements per day, and make sure they increase their hemoglobin. You also can give them folic acid tablets, and that will also help to increase the hemoglobin. Sometimes you can even give them vitamin B12, because that too can be a cause of anemia in pregnancy, and her hemoglobin will increase. There are some special types of anemia in pregnancy. I'll just touch upon them. One is called as a thalassemia, and another is called as a sickle cell anemia. So both these are basically inherited disorders that is, parents will tend to pass it on to their children, and the reason is a genetic reason. Something what one must know about thalassemia is, if a person is diagnosed as a thalassemic and before marriage, or he or she has a minor thalassemia, then while selecting the groom, one must be upfront and tell them that I have anemia, which is thalassemia minor, and so the groom should never have, or the bride should never have, a thalassemia minor, because if two thalassemia minor, a male and a female, they get married, then there is a very high chance that the child will be born with a thalassemia major, and that is going to it's a fatal disorder. Basically, it's a fatal. So two thalassemia minor couple should never get married. It's okay if one of the the male or the female is a thalassemia minor, but the other should never be. This is something which is very important. So we have seen that in patients with thalassemia minor, the hemoglobin tends to remain low. And also in sickle cell anemia, there is something called as sickle shaped RBCs, which tend to clog the blood vessels. This also is a cause of anemia, but these are less likely causes. The most common causes of anemia are iron deficiency and folic acid deficiency anemia. I think that should be all. And thank you very, very much. So basically, iron deficiency is caused by a poor diet. Those women who don't eat green leafy vegetables and meat, etc. It could also be caused by poor absorption. So the woman may be having a good diet, but she, because of certain deficiencies, she may not be able to absorb the food. I have not got this question from Fatima. How does iron deficiency? It's not coming in full here. So Fatima is saying, how does iron deficiency anemia during pregnancy affect the baby? So basically, even if the mother is anemic, the baby is a parasite and will try to take as much iron or hemoglobin from the mother. So the effect on the baby will not be much. But if the anemia is very severe, then the baby also may be born anemic. The baby may, there may be sudden intrauterine death. The baby may be born with low birth weight. So these are the things which can happen in a baby whose mother is anemic. Any other questions? So Uma is asking what one should do for anemia. So as I said that you should have a good diet, which is rich in green leafy vegetables. You should have non-vegetarian patients or women can have fish, chicken, etc., meat, liver, kidney, and those who are not non-vegetarian may have other sources of like green leafy vegetables, melons, lemons. And if the hemoglobin is low, then what they should do is start iron supplements with as advised by the doctor. And one is asking what are the symptoms. I just discussed that a woman will be very tired, complaining of fatigue. She'll have breathlessness. She'll have tachycardia, or her pulse rate will be high. She may get recurrent infections in pregnancy, especially some respiratory infections. So these are things what can happen when a woman is anemic in pregnancy. And Umaira is asking what are the risk factors for iron deficiency. I just discussed that those women who are having multiple pregnancy, they have a higher risk of getting anemia, or pregnant teens, they have a higher risk, or those women who are anemic before they get pregnant. So in those cases, they will have more chance of getting anemia. So somebody is asking, is anemia being treated? Yeah, of course, anemia can be treated. And I just mentioned that we have very good iron capsules and folic acid supplements. This will treat the anemia. And if the anemia is severe, and if the woman is about to deliver and there is less time, and we have even what is called as a iron IV or intravenous iron supplements or intramuscular iron supplements, and we can give them directly through the intravenous injections. And nowadays they are very safe, and this will improve the hemoglobin rather very, very quickly. Within, say, a matter of about 12 to 15 days, we have seen that the hemoglobin can rise by even up to about 1.5 to 2 grams So somebody is asking that my wife is 6 weeks pregnant, what to eat and what not to eat. So the basic advice is to eat home food is the best. Should have a lot of green leafy vegetables, milk, bananas, fruits, chapati, rice, dal, chawal, and avoid the non-vegetarian food. And in the first 3 months, that is what we generally say. But after 3 months, one can have non-vegetarian food. And generally, I tell patients to avoid papaya, pineapple, and mango. I also suggest that they shouldn't have too much of dry fruits in the first up to about 6 to 10 weeks. After that, they may have almonds, etc. Pooja is asking, are there any side effects of iron tablets? Yeah, so iron tablets unfortunately do have side effects. And these side effects are like some women complain of constipation. Some women complain of dark stools. Some women will say they have acidity, gastritis, nausea, vomiting. Some women even complain of diarrhea. So yeah, so these are the side effects of iron. But you do have some medicines which are, as I said, sustained release, and they can be released slowly over a period of time and in the blood, and they are to be taken once a day, and the chance of side effects is less with these preparations. Yes. What if anemia has been seen during pregnancy? Will that affect on the baby? So as I said, if the anemia is mild or moderate, say hemoglobin is around 9 or less than 10, it's unlikely to affect the baby. You should not be worried. You should be worried about yourself. You'll get tired and you may lose a lot of blood in pregnancy, in delivery, and that is likely to affect you. But if the anemia is severe, that is your hemoglobin is less than 6 or 7, then yes, it's likely to affect the baby. And one can land up, as I said, with premature deliveries or preterm deliveries. Sometimes the baby may die inside the womb suddenly. So these are the side effects which can happen if the woman has severe anemia, which is less than 5 or 6 grams in pregnancy. So these are the effects on the baby. Thank you. So yeah, the takeaway is that if you get or planning to get pregnant, check your hemoglobin, that is a CBC. And if it is say 10 or 11, more than 11, then it's good. But if it is less, then it's a good idea to first start some iron supplements, bring your hemoglobin up to more than 11 or 12, and then plan pregnancy. And as I said, another supplement which everybody should take is a folic acid or a folate. So you should take about, say, at least 1 milligram or 2 milligrams folic acid supplement even prior to planning pregnancy. This will help to prevent anemia, but more importantly, folate supplementation has been known to prevent or reduce the chances of the baby getting spinal cord defects or spinal cord abnormalities or spina bifida. So, and always when one gets pregnant, it's good to have a good iron rich diet, diet which is rich in folic acid, and keep checking your hemoglobin as the doctor says. Normally we try to do it once in the first 2 or 3 months, and we try to repeat it at least once or twice later, especially in the 7th month. And we try to make sure that the hemoglobin stays at 11 or more. Thank you very, very much.